Have you ever pondered the potential hidden dangers that may be present in your daily routine? Factors that could unexpectedly turn deadly as we age past 70? Our bodies become more susceptible to certain health risks as we age, risks that may not always exhibit obvious warning signs. While many may believe sudden death to be an unfortunate and unpredictable event, the reality is that there are specific triggers that significantly increase the likelihood of life-threatening emergencies. What's more, most of these triggers are often overlooked until it's too late. In this video, we delve into 5 sudden death triggers that can catch individuals off guard after the age of 70. These are not mere random health concerns. They are silent killers that strike unexpectedly. From unnoticed heart conditions to seemingly harmless everyday habits, each of these triggers can have devastating consequences if left unaddressed. However, there is good news. Once you are aware of these triggers, steps can be taken to protect yourself and reduce your risk. Stick around till the end, as understanding these 5 triggers could mean the difference between living well into your golden years or facing an avoidable health crisis. By the end of this discussion, you will have a clear understanding of what to be wary of, and more importantly, how to safeguard yourself against these risks. Let's dive into the first trigger. One of the most perilous health risks after the age of 70 is a silent heart attack. Unlike the dramatic depictions seen in movies, where individuals clutch their chests and collapse, silent heart attacks can occur without obvious warning signs. Instead, they can sneak up quietly, often mistaken for indigestion, fatigue, or flu-like symptoms. The problem lies in the subtlety of these symptoms, leading many to forego seeking medical attention, allowing damage to the heart to go unnoticed until it's too late. Consider Richard, a 74-year-old who enjoys morning walks and rounds of golf. A few months ago, he felt unusually fatigued, short of breath, and experienced slight discomfort in his upper back. He attributed these symptoms to poor sleep and brushed them off. Little did he know, Richard had just suffered a silent heart attack. Since he did not experience the typical chest pain associated with heart attacks, he dismissed it as nothing serious. However, weeks later, the damage to his heart had already taken its toll, putting him at a heightened risk of sudden cardiac arrest. Silent heart attacks occur when blood flow to the heart is obstructed, with symptoms manifesting in subtle ways. Instead of sharp pain, one may feel discomfort in the jaw, neck, or upper stomach, along with dizziness, fatigue, or nausea. Despite the absence of severe pain, the heart is still deprived of oxygen, leading to cumulative damage over time. The real danger lies in the increased vulnerability to subsequent severe heart attacks if the heart has been weakened by a prior silent attack. Many individuals only discover they had a heart attack during routine checkups, or tragically, after collapsing unexpectedly. This underscores the importance of awareness. Any unexplained fatigue, shortness of breath, or unusual upper body discomfort should not be dismissed. Prompt evaluation through an electrocardiogram or blood test can reveal any silent heart damage. Recognizing warning signs, even when seemingly mild, can be the difference between life and death. Moving on to the second trigger, postural hypotension and falls. A sudden drop in blood pressure upon standing may seem inconsequential to younger individuals, but can prove lethal after the age of 70. Postural hypotension can lead to dizziness, lightheadedness, and fainting, posing a significant risk of dangerous falls for seniors. Falls can result in fatal head injuries or hip fractures, yet many fail to recognize postural hypotension as a serious concern until they've already experienced a fall. Take George, a 78-year-old who enjoys his morning coffee at the local diner. One day, he stood up too quickly and felt the room spinning, leading to a fall and a fractured hip. Despite assuming recovery would be straightforward, complications arose, resulting in a prolonged hospital stay battling infections. What initially seemed like a minor dizzy spell turned into a life-threatening ordeal. Falls remain a leading cause of injury among seniors, emphasizing the importance of acknowledging and addressing postural hypotension to prevent such incidents. The primary health risks for seniors are not just immediate injuries, but they can also lead to a decline in overall health. For example, a hip fracture could result in months of immobility, weakening the body, and increasing the risk of blood clots and infections. Many seniors who experience a major fall may never fully regain their independence, as the complications that follow can be devastating. Postural hypotension tends to occur more frequently with age due to the body taking longer to adjust blood pressure when transitioning from sitting or lying down to standing. Factors such as inefficient blood pumping by the heart, dehydration, medications, or underlying health conditions can exacerbate this issue. Seniors may feel fine when seated, but feel lightheaded when standing suddenly. This can happen without warning and lead to a chain reaction of health problems that are hard to recover from. Lifestyle adjustments like rising slowly, staying hydrated, and reviewing medications that could contribute to low blood pressure can help reduce the risk. However, awareness is key, as recognizing warning signs early and taking precautions can prevent life-altering falls. If you find these insights valuable, please leave a comment below. Additionally, deep vein thrombosis, DVT, is a silent killer that can develop slowly and strike without mercy. Harold, a 76-year-old man, experienced mild swelling in his calf after spending hours in his recliner. Ignoring the symptoms led to a clot traveling to his lungs, causing a sudden collapse. DVT can affect active individuals as well, especially older adults due to naturally slowing circulation and underlying health conditions. Preventing DVT involves staying active, stretching regularly, and seeking prompt medical attention for any concerning symptoms. Another overlooked risk for seniors is undetected infections leading to sepsis, a life-threatening condition triggered by the body's extreme response to infection. Vigilance and early intervention are crucial in managing these hidden dangers for older adults. Organ failure, shock, and sudden death can result from sepsis, making it a dangerous condition due to its initially mild symptoms that many seniors tend to ignore until it is too late. An example is Walter, an 81-year-old who seldom visits a doctor. One day, he notices increased urination and a slight burning sensation, but dismisses it as a part of aging, only increasing his water intake. However, he soon experiences fatigue, confusion, and coldness, which persist despite the warm weather. Eventually, his family convinces him to seek medical help, but by then, his infection has spread to his bloodstream, leading to organ failure despite medical intervention. Infections such as UTIs, pneumonia, or skin wounds can quickly escalate into sepsis, especially in older adults whose weakened immune systems struggle to fight off infections. What may start as a minor infection can progress into a life-threatening emergency if bacteria enter the bloodstream, emphasizing the critical importance of timely treatment to prevent organ failure. Recognizing early sepsis symptoms, such as fatigue, mild fever, confusion, or weakness, is crucial as they can mimic everyday issues, leading many seniors to overlook them until it is too late. Taking infections seriously, seeking medical attention promptly if symptoms persist, and recognizing signs of sepsis are vital steps in preventing life-threatening consequences. Medication mismanagement is also a significant risk for seniors, with errors such as taking the wrong dose or mixing medications posing serious health risks. As the body processes medications differently with age, seniors must be vigilant in managing their medication intake to prevent adverse reactions that could result in fatal outcomes. Keeping an updated list of medications and adhering to proper dosing schedules can help protect against medication-related emergencies. When seeing multiple doctors, it is crucial to ensure that each one is aware of all the supplements you are taking in order to prevent any potentially dangerous interactions. It is recommended to use a pill organizer or set reminders to help you stay on track with your medication regimen and avoid missing doses or accidentally taking too much. Before starting any new medication, whether it is prescription or over-the-counter, it is important to consult with your doctor or pharmacist to confirm its safety in conjunction with your current medications. Your health should not be left to chance, as even a small mistake with medication can have serious consequences. Staying informed and organized can be the difference between life and death. Moving forward, let's reflect on the final thoughts regarding sudden death triggers after the age of 70. It is important to consider which of these risks may apply to you or someone you care about. Many people underestimate how fragile certain aspects of their health can become as they age, and the most dangerous threats are often overlooked until it is too late. However, awareness is key to prevention. Simple changes in daily habits, such as standing up slowly, staying hydrated, and remaining active, can make a significant impact on your health. Double-checking medication dosages and interactions is also a powerful way to protect yourself. The goal is not to cause alarm, but to empower you with knowledge so that you can take control of your health. Recognizing warning signs, such as those of a silent heart attack, being vigilant for early symptoms of sepsis, and taking steps to prevent dangerous falls, can potentially extend your lifespan. Proactively managing your health is not just about avoiding risks, but also about ensuring that you can continue to enjoy life, spend time with loved ones, and pursue activities that bring you joy. Your feedback and insights are valuable to us, so please share your thoughts in the comments below. If you found this information helpful, consider liking, subscribing, and sharing our content to support our mission of informing and inspiring others. Thank you for watching, and we look forward to connecting with you in our future videos.